So today, as I said, we have with us Steven Nguyen from our center, Families Helping Families of Greater New Orleans. Steven's been with us for 12 years as our community resource specialist. So, Steven, tell us a little bit about yourself and why you are a pro at talking with healthcare professionals. Unmute yourself first.
Good morning, everyone. My name is Steven Nguyen. I am 34 years old. I was born with a condition called spina bifida, which is a neural tube birth defect. So it affects my brains and my spine. So as you can probably imagine, I have a very complex healthcare condition. So as far as the reason that I'm a quote unquote pro, I think it's because I do have a lot of lived experience, and kind of tying that into my professional life. I've I've learned to navigate a thing or two.
Yeah. So when did you begin to use your own voice during doctor's appointments? Do you remember that?
So it was probably around the age of 10 or 11. That's so I, as you can imagine early on, I mean, you didn't have a crazy big conversations with healthcare providers, but you did answer questions and you kind of started that conversation. But it wasn't probably until I was maybe 16 going on 17 where I actually the doctors would actually ask my mom to step out of the room and we would just have conversations. I mean, yeah, mostly it was around health, but most of my doctors knew at the time that I loved different things, so football and everything. So we would just talk sports, and I think that whole experience helped me be comfortable with speaking with providers, and yeah.
So what kind of a response did you get from providers when you started managing your own visits? And I think you told me the other day that when you turned 18, it was on you, right?
Absolutely.
So what was their response when you started doing things on your own? Did you have to transition at the exact same time, or did you still have some of the same providers?
So right when I was around 18 years old, I did have to seek out adult providers. Thankfully, most of my doctors that I saw on the pediatric side kind of helped me with that transition and kind of prepared me to just going from pediatrics to adult care. So I think the role that healthcare providers play is crucial as far as connecting their families to resources once they reach the age of majority, which is 18 for Louisiana. So yeah, overall, the response was very positive. Yeah.
When did you start making your own appointments and pretty much handling the whole thing on your own?
So I guess when I was legally able to do it, so around 18. But I did start early on just doing the simple things like calling in certain medications and just making my own appointments. I mean, things weren't really virtual back then, but it's a whole lot easier to make appointments and schedule refills these days with electronic health records. So I think that's a plus.
That's a good point because even like we use CVS and we have the CVS app that we can just pop on and request a refill, and they're always texting us when things are ready or when they need something else, doctor's approval or whatever. Do you think
Yeah,
that kind of thing, the technology makes it easier for
absolutely.
people who
Yep,
who may not be comfortable talking on the phone or.
absolutely. It helps a lot. I mean, even for people who may not have a lot of time just to pick up the phone and give their providers a call. I mean, the boom with electronics these days, it's just crazy, and the advancements that between the electronic medical records and just simply calling an automated line to get your prescriptions. It's been very, very cool to see.
Yeah, that's a good point, because I know that's helpful for youth and young adults who may not be comfortable talking, or even who may not be able to talk and hold a conversation, but can do those things cognitively, you know.
Yeah.
So, what kind of things do you look for in a provider?
Um, One that's listens to me and my concerns is first and foremost one of the most important factors in who I want to take care of me and trust with my medical care. Someone who's empathetic, I'm sorry. And one who may not always know the answer, but they're willing to go out of their way to help you find the answer that you need. I realize that everyone is human, and just finding somebody that listens to you, and if they don't know the answer and will seek it out for you, I think that speaks volumes on a doctor and your healthcare as a whole.
Especially if you're someone who has a complicated health history, it's hard to
Absolutely.
find someone, I'm sure, like a GP or an internist who
Mhm.
knows everything about that particular
Absolutely.
healthcare issue. So
Yeah.
finding someone who's willing to just step out and get the information that they need is very important.
Yeah.
Have you ever left a
Absolutely.
provider because you didn't feel heard or acknowledged or anything like that?
I've probably left more healthcare providers than I care to admit. I mean, as you see a provider or staff or something like that, you begin to pick up on different things, and if it's not something that you're comfortable with, I mean, chances are you may have to find a provider. Yeah, so there have been times in my life where I've had to look elsewhere. I mean, I've been turned away because I've been told that my healthcare condition was so complex that they don't even want to touch me. They don't even want to see me or anything like that. So there have been those instances as well, and it's frustrating, but it's all part of life. And there are good providers out there. It just sometimes you just have to find them, right? Especially if you have a special health condition that it's just nobody really feels comfortable with seeing you. So
And then you can add on to that if you're dealing with Medicaid or Medicare or private
yeah,
insurance, and what providers,
yeah,
that you find that will see you, but they don't take your insurance,
yeah, yeah, and that's absolutely true.
that's frustrating. So some of
There's
those
so
things
many
are
factors
difficult.
that play, so many factors at play here, and yeah, it can be very frustrating sometimes. But
What do you do
eventually,
when, I'm sorry.
go ahead.
What do you do when you get frustrated and like you're trying to find a provider? Is there someone that you talk to or call on, or you just keep plugging away? What's your response when you're having difficulty?
So honestly, I think it's important in this case to have a very good primary care provider. So the doctor that I currently see, he's been great. Every time I need a certain specialty, I actually stat and wrote down all the providers that I've seen throughout my life, and I've probably seen like 17 or 18 different providers just on my condition alone, and all the other secondary conditions that I live with. So I mean, this is not just doctors. This is therapists and orthotic specialists. So my transition, my healthcare team is fairly extensive.
Right. Wow. So with that, what lessons have you learned that you would like to share with the folks that are here?
So I think first and foremost, it's important to start the transition process early. If you're not going to take action right then and there, at least have that conversation with the people that you trust, right? Um, we we consider transition as as not a sprint but a marathon. So it does take time. So you just really have to get out and go. I mean, there's no at some point in time, you're going to be told by pediatric doctors that they can't see you anymore. So you kind of have to, you can't really avoid the inevitable, right? Um, for the youth and young adult out there, I think it's important to know your basic medical history. What I like to say is maybe elevator speech. So something very quick, but gives the other person a good idea of who you are and kind of what your life is about and what's your diagnosis, right? I guess this advice here is more in the realm that you're currently seeing a provider. Is maybe a little pre-planning before your appointment. So write down the questions that you may have for your providers and just relay that message whenever you get to your appointment. I know that for someone like me who may be forgetful at times or maybe a little shy and nervous, I always have little notes that I write on a piece of paper or I have in my phone, and I always go through that list as I'm talking with my doctor. So that really helps me in those instances.
That's a good idea. That's a good idea. And that will help someone who does get nervous talking to, a professional.
Mm-hmm. And also ask with electronic medical records, you can always ask for a copy of the notes after your appointment. So
true. Mm-hmm.
I would encourage you to ask for those notes and keep them in a folder or something. So that way, if you forget what you talked about at the last appointment, you can always refer to those notes. And if you have another appointment to follow up on, that might be good to have in your medical records, just to have on you.
Mm-hmm.
And that applies with anything, medications, maybe you have labs or stuff like that. So it's really important.
Yeah, that's a good point. One thing that I did with my son, who also has, as you know, significant medical issues and a wide range of issues.
Mm-hmm.
When he was little, I took one, just like one sheet of paper, and I made a form, not really a form, but I made just a history of who he is. It was his name and birth date were at the top, a little brief blurb about his history, any medications he was on, all the specialists he was seeing. When he was younger and had a ventilator, I had all his ventilator settings on there, his tube feeding schedule, and everything, every single thing that anybody would need to know. And I took that with us to all doctor's appointments, and I also kept it in a bag that we had to take everywhere we went. I kept that updated and in there so that if we found ourselves at an urgent care or emergency room, I would have that, because when you're stressed out, you can't spout out all that information and milligram dosages and all that kind of stuff. And, and sometimes when it's a lot of information, that's just much easier. I find that the triage nurse, when we go into an appointment, is very appreciative of the list so that she can just look down and update, what's on the computer. So that's another idea for transition and to help with keeping from having to, constantly regurgitate that information over and over. And if there have been changes, it's also easy to keep up with.
Absolutely. And I always joke with my friends who have the same condition that I have, that we have, probably looking back at our records, we probably have thousands and thousands and thousands of documents related to our history, and it would always be fun to print it out and give to people.
Yeah, I don't think I'd pull that out at parties. Steven, just a little word to the wise there, buddy. All right. So any other advice that you have for youth and young adults and their families about starting to navigate their own healthcare?
No, I just want to reiterate that it's really important to start as early as possible. Start at baby steps. I mean, and once you start building that confidence up, things start to become easier, and you'll learn different tips and tricks along the way. But yeah, it's just really important to start early. And I do want to share a couple of resources specifically related to healthcare transition. So the first one is there's a website that offers a lot of toolkits and checklists on healthcare transition, and that website is www.smoothmovesyht.org, and the other one is www.gottransition.org. So I do encourage you to check out those resources, and you'll definitely find things on there that are appropriate and suitable to help you with this healthcare transition process.
Thanks for those. I'll get those from you. I didn't get the second one. I know Smooth Moves.
I can write it
I'll
in
send
chat.
those out.
Yeah.
And I'll send those out too in the follow-up email to this. And everyone, Steven and I are also working on a special webinar that we will be having in January on healthcare transition to adulthood. That'll be January 24th at 10 a.m. And our presenter for that will be Patty Bearvecchio. She's an RN consultant with the Bureau of Family Health. And she is the one who actually did the Smooth Moves YHT website. She's really, really good. So if you have questions, bring those. You won't want to miss it. She really is the guru for healthcare transition to adulthood, and will be available to, answer questions and things. So Steven, thanks so much for being here, folks. If y'all have any questions for us, I'm going to send you an email here in just a few minutes. If you have questions, email me back, and we'll get those, and we'll hopefully get some answers for you.
Yeah, and you all can feel free to send me an email or give me a call, and I'll be happy to discuss privately if you have any personal concerns or need some personal assistance with anything. Just give me a call, and I'll be glad to see what I can do to help.
All right, I'll put Steven's contact information also on the email, so you'll have access to that.
And just know that transition is always it's always a learning experience, right? So even though I'm 34 years old, I still learn things along the way. So
yeah, absolutely. Well, we all do. I mean, I'm a little bit older than 34, and we all are continuously learning. So great tips, and everyone have a happy Monday, and we'll see you again soon.
I appreciate y'all having me. Thank you so much. Y'all have a great day.